Hey, I decided to go ahead and remake the video that I had because there was kids screaming in it, so I figured you could hear it clearer this time. I'm going to show you how to put a baby who is about 6 months old on your back in an SSC, which is a soft structured carrier. I want to make a note that they shouldn't go on your back until they can sit up unassisted. And that's about the same time that they're going to eat solids as well. You can put them on your back earlier if you know how to wrap, because that can be adjusted differently and tighter in certain areas and give them more support. But until they can hold their whole body up sitting, you should wait to put them on your back, neck included. Especially because they'll fall asleep and they need to be able to kind of hold themselves up a little bit better. So here's Toby. We're going to put him on my back. His favorite place to go because he can see so good. Alright, so first step is put your carrier on like normal. This method is called the hip scoot method. And I kind of do this with a ring sling too, sometimes even with a wrap. I'm going to have it a little bit looser than I want it. Just a little bit. And I love how on a KP you can pull from either direction, so that kind of makes it nice. I'm going to go ahead and put him on. Come here, Bubba's. Oh, just like I were to wear him in front. Alright, so just like I'm going to carry him in front. You want their knees bending. I always make sure, because sometimes when I put them on my back, they kind of scoot. Alright, knees bending, we're good to go. Now, instead of going ahead and putting it on like this, which you can go ahead and do that, and then snapping the back, hey, this is what you're gonna do. There's two methods. I use my teeth sometimes to hold one of the straps like this, which is fine with me, but if you're not comfortable using your teeth, you can put them both in one hand. So I'm putting it in my right hand. See, he's hanging just a little bit, but he's fine. And then I'm gonna switch to my left hand so I can get my right hand out from underneath. So now you have your hands on top. And I'm gonna switch my hands in their straps. So cross the opposite straps of what was on my body, okay? Actually, right there. So I've got my left hand, I know I'm leaning him far. I've got my left hand underneath and my right hand on top, crossed in an X. Does that make sense? Okay, left hand and then right hand, straps like that. Okay, so I'm gonna go back to do that one more time. All right, so I have both of them in the same hands that they were on my shoulders, right? And I'm gonna switch them. Left hand under, right hand on top. So opposite hands. He likes this part, he's just staring up at me. And then what I'm going to do is hip scoot him. I've got a lot of practice where I can pretty much just swing him straight to my back. I use my left elbow as the kind of barrier to hold him down. So most people just scoot. I like to just walk. See, I've still got my elbow on him so he doesn't fall out. And you just scoot him all the way back and then put it on. It's akin to when you're in high school or middle school and you just take your backpack and swing it on your back. That's kind of what I feel like. So you snap it up. When they're little, you don't have to do this, and a lot of men don't, but it's much more comfortable the higher you get them. So I put him as high as I can possibly get that strap. Sometimes it needs to be higher, so you bounce, scoot, see how he's kind of saggy, so I can tighten him up a little bit more. There you go. And what you might want to do is get someone to help you. Certainly spot over a bed or have somebody spot with you until you practice enough to get good at it. But also, once you get them up, you may want to work on the PFAS straps right here to get it nice and tight to where they're not saggy. And then the next time you put them on, it'll be a lot better. But I feel his weight more right here, up here, than down here. Mine has a longer, so it kind of sits on the top of my rear. But that way he can kind of see over my shoulder. I can look back and see his eyes and make sure his head's not slopped too far away the other. When you want to take him off, okay? Be really careful once you do that, because clearly your straps can just come off. I do a little bit of loosening in all the straps. Take it like I'm gonna take it off. Now, I kept them tight the whole time, pushing up against my body. So I never just took it off and flopped, but kept them tight. And then you're just gonna go reverse, scoot, bounce and scoot around your head. Again, the reverse of what we did. Put it in one hand, switch back to both hands, and then you can either wear him front or take him off. Say bye.